So we're going to look at an arthroscopic acromio clavicular joint reconstruction. This is a collegiate athlete who had a traumatic grade 3 AC joint dislocation or separation. And I've got the camera in the glenohumeral joint. We want to make sure that there's no associated tears of any of the other structures in the shoulder, which is fairly common. I've got a cannula in the front of the shoulder, immediately above subscapularis, which is that white band-like tissue going across the bottom of the screen there. And what we're doing here is we're backing this cannula out so that I can enter a shaver and just open up this window a little bit. This is called the rotator interval, and I just want to open this up. So we're going to open this enough so that I can see the bone lying immediately beyond it, and here it is. This is the coracoid, which is a difficult structure to describe. In the animated sections on the website you can see some of the normal anatomy here, but the coracoid is a projection off of the scapula or the shoulder blade, which really comes sort of straight out towards the front of the shoulder, and along its superior or top surface are the coracoclavicular ligaments, which are torn in this injury. There are some important structures that lie around it, and so what I've got to do here is define the perimeter of the coracoid a little bit, make sure that we protect the suprascapular nerve, which lies along its medial border, as well as the conjoined tendon and the pec minor. So I back out to give you a little perspective here, show you where we are, and then we'll zoom back in, and there's the coracoid. We'll try that one more time so you'll see exactly where we are. We're in the back of the shoulder. We're going to look through the shoulder joint and out our little window that we made. So I've got a guide here so that I can place a small guide wire targeting to this metallic guide that you see here, and then once our guide is through, which you see here, then I will place a small drill over the top of it to ensure that we drill in the appropriate orientation. The drill is not much smaller than the coracoid itself, and so it has to be center. I've fed a little wire through our drill, and then I'm going to come in with a small instrument and I'm going to grab this wire and I'm going to bring it out the front of the shoulder. And then once I do this, we're going to use that as the shuttling device, and so we'll remove the drill or the reamer as we call it. And outside the shoulder, along the top of the shoulder, I am passing sutures through the other end of this wire so that I can pull this wire and, in effect, pull the suture, which you see there, and then subsequently the graft and the small metal button, which we'll use to secure the fixation here. So I've got a knot pusher. This is similar to what we use when we're tying arthroscopic knots, and that way I can slip it over this suture and safely provide some traction without having to worry about slipping off of it to some of the very important structures which lie near here. So as I pull with varying angles, you'll see the metallic buttons come into view here. So this means that our graft has passed through the clavicle, through the top of the coracoid, and is now sitting at the bottom of the coracoid. And once I get our angle right and our graft passes, then the button will come all the way through here, and then we'll essentially flip it so that it lies flush on the undersurface or the inferior aspect of the coracoid. So here it comes, and once we get it all the way through, then you can see it lying there. There's some redundant tissue here because I do not excise all this tissue. I just sort of open up the window. So I'm going to place this small metal instrument, which is called a nerve hook, or it's also called a probe. I'm going to place it. It fits nicely in the small eyelet where we fed our sutures through here, and I'm going to use that to spin the button around to the appropriate location, and then along the top of the clavicle, which you can't see here, I'm tensioning this down so that we have our appropriate tension and make sure that everything lies anatomically. This button works like a price tag holding the graft securely, and then I can remove this traction suture. So we get, there's the coracoid, there's the button lying right in the curvature. It's exactly where we want it. So we make sure that our tension is correct, and then we'll look down through our small incision, which is about the size of the quarter. You can see the graft coming through the metallic button, and now we've cut that graft. It's lying flush on the surface of the clavicle. This is a small incision about the size of a quarter, and our arthroscopic reconstruction is completed.